Good morning, everyone. Welcome to my 6-month progress report presentation. My name is Kata, Haba, and my PhD topic is about the oral complications of type 2 diabetes mellitus. I'm a second-year resident at the Department of Periodontics. I have 2 supervisors, Daniel Vég and Dóra Haluska. My SMS is Cindy. My statistician is Gergely Agócs. My vision is to improve the life quality of patients with diabetes, and my mission to it is to assess all the potential oral complications of diabetes and target them. Right now, I have 2 specific goals ongoing. I started both of them last year in autumn. Let's jump to my first one. This is about the correlation between salivary and blood glucose levels. I would like to achieve it through systematic review and meta-analysis. My co-investigator for this project is Patrick Reuter. Little background for it. Diabetes mellitus, chronic metabolic disorder, affects many organs in the human body, including the oral cavity. And there are many million patients who have to endure the inconvenience, cost, and pain of measuring their glucose level from blood sample on a daily basis. Therefore, my aim is to detect a potential new method for glucose level measuring in a less inconvenient way, if possible. My clinical question for my first project would be, what's the relationship between salivary and blood glucose levels after fasting? We chose the PERD framework for that, where the population is a general population. The index test would be saliva test based on glucose oxidase methods. My reference test would be a blood test, and the diagnosis of interest is correlation. And my hypothesis is that the salivary glucose level matches with blood glucose level after amount of fasting. Again, my clinical implication is to detect a new method, if possible, for glucose level measuring. Here you can see my systematic search. I did it in 4 databases, started on the 22nd of November last year, and here you can see my accepted search key below. And this is my flowchart of selection. At the end of this part, we had 25 eligible full text that we'd like to include in our study. For the outcomes, I have 2 ongoing analyses so far, a meta-regression analysis and the forest plot for blood glucose levels, and I have 3 finished analyses. 2 of them are for the correlation between salivary and blood glucose levels based on mixed saliva and based on saliva isolated from parotid only, and the forest plot which I just got yesterday for salivary glucose levels. Let's see my first one. We could extract some IPDs, individual patient data, from 10 articles. And on the scatter plot, you can see them measured both in the European and American measuring units. The green range shows us the normal range for blood glucose level, and the thick black line shows us the trend line for mixed model. We expected a much more significant correlation between the two tests. However, it doesn't show us that much correlation based on the R-square values. So we went back to the literature, where we found that maybe if we extract the data only from saliva isolated from parotid, it could show us a much better correlation. So we did it. There were 3 articles where we could extract IPDs. It shows us a much better correlation. However, it's still not the best, but I have to mention that one of the articles is ancient, so maybe based on the technologies that developed so far, it could be much better. And my third result is a first plot, where we included all 25 articles. The measuring scale of statistic was mean differences. The experimental group was for diabetic patients. The control group was for healthy people. Our heterogeneity was 99%, which is very high. However, both the experimental and control group included many patients, so it could be based on that. And as you see, our difference is statistically significant, but based on the findings that we had based on the IPDs, it could not be clinically significant. So we have to check if there's relevance for these mean differences. For strength, I have to mention that all the methods that the articles describes are very well described based on the sample takings, and they enrolled big number of patients. However, only a few articles included the IPDs, and some article doesn't mention potential health data that could potentially influence the measurements. And for conclusion, first I'd like to mention the implications for research. We need to describe the exact measuring methods that could be used for a salivary glucose testing. And based on what Professor Varga recommended us, we need to make some age grouping to see if there's some influencing factors based on the ages. And for implications of practice, based on the data we have, we do not recommend to use salivary glucose level instead of blood glucose levels yet, but we'd like to improve it. And this is my first project progress so far. I'm by the figures and tables phase right now. Let's see my second one. That's about evaluating oral hygiene and periodontal complications in patients with hyperglycemia. It would be also a meta-analysis and systematic review. Investigating the link between periodontal health and hemoglobin A1C level, that's an indicator for glycemic status, is crucial for enhancing diabetes management because periodontal health can impact systemic health by potentially worsening diabetes control. On the other hand, elevated hemoglobin A1C level might aggravate periodontal conditions. My aim is to show the need for regular oral checkups among hyperglycemic patients to integrate oral health into managing their diabetic status. My clinical question for my second topic is about how does the abnormal hemoglobin A1C level affect periodontal outcomes. We chose the PFO framework for that, where the population would be hyper and normal glycemic patients, the prognostic factor would be different hemoglobin A1C levels, and the outcomes would be periodontitis. As we talked with the statisticians, we could determine some predictors, like the main predictor would be hemoglobin A1C level. Additional predictors would be the duration and status of periodontitis and DM, and the response variable would be the pocket depth and clinical attachment loss, and we'd like to do it with a regression model. My hypothesis is that the stage of periodontitis is more severe in patients with hyperglycemia. And again, my clinical implication is to emphasize the importance of frequent dental checkups among patients with hyperglycemia. On this slide, you can see my 3 key articles. All of them are from last year, so I think it's a pretty hot topic. And I just wrote up the PFO framework for them. As you can see, we can comprise the periodontal status in all of them. The hemoglobin A1C levels were available in all of them. And they include questionnaires, and we'd like to examine if we could compare them too. As for a summary, here you can see my planned submission dates for both of my projects. For the first one, it's May this year, and for the second one, it's September this year. And I thank you for your attention by a quote from Louisa May Alcott from Little Women: "No good can come from doing nothing." Thank you very much.
Can you tell us a bit about the reasons why there's such high heterogeneity between your studies, and if you plan to do any statistical approach to deal with that, so we could have maybe more clear results or a clear idea of what happened?
Yeah, well, as I mentioned, the inclusion and exclusion criteria weren't well defined, so maybe that could lead to a very non-significant result in the groups, and they included many patients. However, I don't think that the control and the describing how they selected them is very well described, so that could lead to us.
Is there anything that you could do statistically to better approach this?
We'll see.
Okay.
We'll see.
Okay, thank you.
Okay, thank you.
Do you have any data if these patients had controlled or uncontrolled diabetes?
Thank you for your question. Yes, some of them dispersed them into 2 groups based on the controlled and uncontrolled status of diabetes. However, we talked about it with our supervisors, and they told me, well, if we want to measure their glucose levels and we included the normal glycemic patients also, then it's not significant if they are controlled or non-controlled.
Do you know whether the salivary secretion rate could influence the glucose level of the saliva?
In the methods part, all of the articles contained only a determined amount of saliva that they needed, and they had to rinse their mouth first. So they just collected a described amount of saliva. So I don't think it's relevant by this question.
In your included articles, were there any of them who reported prediabetes in this population?
Yes, they did. And we included them if we could. But sometimes they didn't describe the exact ranges for diabetes and pre-diabetes in their articles, and it differed from what the literature told us, so we had to exclude some of the articles based on that.
How was the experience of evaluating each patient on your plot?
Well, it was stressful, but I did it. I had 900 individual patient data that I could extract, and I could do it based on the tables and based on the diagrams that they included, and I did it with a web plot digitizer if it was possible.
Maybe in the future, do you want to merge these two projects together and do a registry in Hungary?
Yes, that would be awesome. That would be my third project. We just talked about it with our supervisors, but yes.
Okay, thank you.
Thank you.
Did you find in the articles, in the inclusion criteria, the bruxism or clenching and the restoration, some kind of crowns or something, because they can also cause CAL?
Not yet. As I looked into these articles, in the 3 key articles that I have, they didn't mention anything about restorations and bruxism so far, but thank you for your opinion. That would be nice to investigate them also.
I think that you said in your first project that you find better correlation in the newer articles. Mm-hmm. Do you know what is behind this?
Yes, I think that maybe as the technology develops, it could affect the measuring technologies as well. And my newest article shows the best correlation, and that could be the base of it, because measuring the salivary glucose levels in my article from 1981 doesn't talk about much how they do it. They just do how they think they could. But by my newest articles, they have a very good description how they exactly do the measuring and the laboratory work behind of it.